Introduction to Anatomy. Anatomy. Textbooks, Dictionary and Atlas Gross Anatomy. Snell's Clinical Anatomy by Regions. 10th edition Drake, R.L., Mitchell A.W.M., Vogel A.W., and Mitchell A.W.M., 2015. Gray's Anatomy for Students 3rd edition. Churchill Livingston Elsevier. Histology, De Fiore's Atlas of Histology with Functional Correlations. 13th edition. Wolters Kluwer, Lippincott, Williams, and Wilkins. Neuroanatomy, Snell's Clinical Neuroanatomy. 8th edition. Embryology, Sadler, T. W. Langman's Medical Embryology. 14th edition. Wolters Kluwer, Lippincott, Williams, and Wilkins. Atlas of Medical Anatomy. Frank H. Netter. 8th edition. Rohan J. W. Yokochi C. and Lucien Drecol. Color Atlas of Human Anatomy. 8th edition. Wolters Kluwer, Lippincott, Williams, and Wilkins. Dictionary, Stedman's Pocket Medical Dictionary. Latest edition. Wolters Kluwer, Lippincott, Williams, and Wilkins, with free e-version. Introduction to Human Anatomy. A history of the development of anatomy. Definition of anatomy, branches, divisions. Levels of organization of the human body. Cells, tissues, organ systems. Essential terminology. History, human anatomy. Ancient Egyptian medical papyrus text, circa 1500 BC. Sushruta, circa 800 BC, father of surgery. India. Ancient Indian surgeon who described over 300 surgical operations and 120 surgical instruments in the Sushruta Samhita, an Ayurvedic text. Hippocrates of Kos, 460, 379 BC. Father of modern Western medicine. Undiscovered tricuspid, valve, Aristotle, 384, 322. BC Galen, 1-20, AD, 280. Studied function of organs by doing live dissection. Shu learnt anatomy by doing animal-based dissections. Roman physicians Abdullah ibn Sina, Avicenna, wrote. The Canon of Medicine and the Book of Healing, misinformed anatomical sketch. Leonardo da Vinci, on anatomy. Studies on arm movement. Father of human anatomy. Founder of modern human anatomy guided dissection by reader of anatomy. Circa 1500s Henry Gray, far as 1827, 1861. Wrote the most famous anatomy book, Moya. Gray's Anatomy currently in its 43-word edition, The Anatomical Position. What is it? The anatomical position is the standard reference position of the human body. In anatomical position, the body is in standing upright, with the feet together, hands by the side face, looking forward, lower margin of orbit on same horizontal plane as the top of the external. Auditory meatus mouth is closed, palms of the hands, face forward, fingers straight and together, toes point forward. Anatomical position, key terms. Anatomical position, anatomical planes, coronal sagittal transverse, anatomical location, anterior, ventral, posterior, dorsal, medial and lateral superior and inferior, proximal and distal, cranial and caudal, superficial and deep levels of organization. The human body is organized in a series of levels: atoms, molecules, cells, tissues, organs, systems, body. Sources give figures that vary from 50 to 100 trillion cells. 97% of body weight is MADE up of oxygen, 63.1%, carbon, 20.7%, hydrogen, 10%, nitrogen, 2.8%. While 3% of remaining body weight is MADE up of some 40 elements. Definition, BEA. Human anatomy is the science which deals with the structures of the human body. Or, it is the study of structures of human body mainly in relation with each other. Facts about anatomy. The term anatomy is derived from the Greek word anatomy, meaning cutting up. The term dissection is a Latin equivalent of the Greek word anatomy. However, dissection is a mere technique, whereas anatomy is a wide field of study. Anatomy is conventionally divided into topographical or gross anatomy, including surface, endoscopic, and radiological anatomy, histology, embryology, and neuroanatomy. Anatomical language is one of the fundamental languages of medicine. Anatomy forms firm foundation of the whole art of medicine. It introduces student to the greater part of medical terminology, how to study. Anatomy was studied mainly by dissection. The main divisions of anatomy are 1. Cadaveric anatomy, 2. Living anatomy, 3. Embryology, developmental anatomy, 4. Histology, microscopic anatomy, 5. Surface anatomy, topographic anatomy, 6. Radiography, 7. Comparative anatomy, 8. Physical anthropology, 9. Experimental anatomy, 10. Genetics, 11. Applied anatomy, clinical anatomy, cadaveric anatomy. It is studied on dead bodies, usually with naked eye. This can be done by two methods. 1. Regional anatomy. 2. Systemic anatomy, regional anatomy. The body is studied in parts like upper limb, upper abdomen, lower limb, thorax, head, neck, and brain. Systemic anatomy. The body is studied in systems like skeletal system, muscular system, articulatory system, vascular system, nervous system, endocrine system, etc. Parts of human body, head, neck, trunk, thorax, limbs, abdomen. Regional groups, head and neck, includes everything above the thoracic inlet. Upper limb includes hand, wrist, forearm, elbow, arm, and shoulder. Thorax, the region of the chest from thoracic inlet, thoracic diaphragm. Human abdomen to the pelvic brim or to the pelvic inlet. Regional groups conteed the back, the spine and its components, the vertebrae, sacrum, coccyx, and intervertebral discs. Pelvis and perineum. The pelvis consists of everything from the pelvic inlet to the pelvic diaphragm. The perineum is the region between the sex organs and the anus. Lower limb. Everything below the inguinal ligament, including the hip, the thigh, the knee, the leg, the ankle, and the foot. Major system, circulatory system, pumping and handling blood to and from the body and lungs with heart, blood, and blood vessels. Digestive system, digestion and processing food with salivary glands, esophagus, stomach, liver, gallbladder, pancreas, intestines, rectum, and anus. Endocrine system, communication within the body using hormones made by endocrine glands, such as the hypothalamus, pituitary or pituitary gland, pineal body or pineal gland, thyroid, parathyroids, and adrenals or adrenal glands. Major systems, integumentary skin, hair and nails system, structures involved in the transfer of lymph between tissues and the bloodstream, the lymph and the nodes and vessels that transport it. Lymphatic major systems, integumentary system, skin, hair, and nails. Lymphatic system, structures involved in the transfer of lymph between tissues and the bloodstream, the lymph and the nodes and vessels that transport it. Musculoskeletal system. Muscles provide movement and a skeleton provides structural support and protection with bones, cartilage, ligaments, and tendons. Nervous system. Collecting, transferring, and processing information with brain, spinal cord, peripheral nerves, and nerves. Reproductive system. The sex organs. In the female, ovaries, fallopian tubes, uterus, vagina, mammary glands, and in the male, testes, vas deferens, seminal vesicles, prostate, and penis. Major systems, respiratory system, the organs used for breathing, the pharynx, larynx, trachea, bronchi, lungs, and diaphragm. Urinary system, kidneys, ureters, bladder, and urethra involved in fluid balance, electrolyte balance, and excretion of urine. Vestibular system, contributes to our balance and our sense of spatial orientation. Living anatomy. Living anatomy is the skill of being able to identify specific landmarks on the body of a patient by touch, e.g., bony prominences, muscle bellies, and pulses, and using those landmarks to identify the position of other structures, such as organs, within the body. It is studied by inspection, palpation, percussion, radiography, electromyography, etc., auscultation, endoscopy, embryology. Embryology is the study of the prenatal developmental changes in an individual. Histology is the study of the microscopic anatomy of cells and tissues of plants and animals. It is performed by examining a thin slice, section of tissue under a light microscope or electron microscope. The ability to visualize or differentially identify microscopic structures is frequently enhanced through the use of histological stains. Histology is an essential tool of biology and medicine. Surface anatomy. Surface or superficial anatomy is a descriptive science dealing with anatomical features that can be studied by sight without dissecting an organism. In particular, in the case of human superficial anatomy, these are the form and proportions of the human body and the surface landmarks which correspond to deeper structures hidden from view, both in static pose and in motion. It is also called visual anatomy. Basically, it is the study of deeper parts of the body in relation to skin surface. Radiology is a medical specialty that employs the use of imaging to both diagnose and treat diseases visualized within the human body. Radiologists use an array of imaging technologies, such as X-ray radiography, ultrasound, computed tomography, CT, nuclear medicine, positron emission tomography, PET, and magnetic resonance imaging, MRI, to diagnose or treat diseases. Comparative anatomy. Comparative anatomy is the study of similarities and differences in the anatomy of organisms. It is closely related to evolutionary biology and phylogeny, the evolution of species. It is the study of anatomy of other animals to explain changes in form, structure, and function of different parts of the human body. Physical anthropology. It deals with external features and measurements of different races and groups of people, and with the study of prehistoric remains. Experimental anatomy. It is the study of factors which influence and determine the form, structure, and function of different parts of the body. Genetics. Genetics is the science of genes, heredity, and variation in the living organism. Applied anatomy. It deals with the application of anatomical knowledge to the medical and surgical practice. Language of anatomy, positions. Anatomical, supine prone lithotomy. Anatomical position. A person is erect, standing straight with eyes looking forward, both arms by side of the body, palms facing forward, both feet together. Supine position. A person is lying on their back, arms by side, palms facing upward, feet together. Prone position. A person is lying on his/her face, chest and abdomen is said to be downwards. Lithotomy position. A person is lying on her back, with legs up and feet supported in straps. This position is assumed during delivery of a baby. Types of planes: median, mid-sagittal, coronal, horizontal. Median plane, also known as sagittal plane, a plane passing through the center of the body, dividing it into two equal right and left halves. Name is derived from sutura between two parietal bones. Mid-sagittal plane also known as paramedian plane, plane parallel to median plane. Coronal plane, plane perpendicular to median plane. Name is derived from the suture between parietal and frontal bones. Horizontal plane, also known as transverse plane, a plane perpendicular to both median and coronal plane, or right angle to both the planes. Uses of planes to explain anatomical terminologies, to study different structures of any organs in different planes, to explain movements of different joints. Terminologies: planes, median, centrally located, anterior, ventral front. When the structures are present in front of median plane, it is called anterior. Posterior, dorsal back. When the structures are present at the back of median plane, it is called posterior, e.g. sternum and heart. Sternum is anterior to heart and heart is posterior to sternum. Medial, structures nearer to median plane. Lateral, structures away from the median plane, e.g. heart and lungs. Heart is medial to lungs and lungs are lateral to heart. Heart and lungs trunk proximal, near root of the limb. Distal, lower part of the limb. Superior, structures near the head. Inferior, structures near the foot. Cranial or rostral, is close to upper end or head end. Caudal, is close to lower end or near to foot. Superficial, outer side towards the surface of the body, close to skin. Deep, inner side away from surface of the body, away from skin. External, outer part of an organ. Internal, inner part of an organ. Invagination is projection inside. Evagination is projection outside. Ventral or anterior is the front aspect. Dorsal or posterior is the back aspect. Palmar of hand. Front side of the palm. Dorsal of hand, back side of the palm. Dorsal of foot. Is the front side of foot plantar of foot? Is the back side of foot plantar radial, near the median plane? Ulnar, away from the median plane. Tibial, tibia of foot. Fibular, fibula of foot combination. Anterolateral, anterior and lateral. Front side and away from the midline. Front side and away from the midline. Posteromedial, posterior and median. Backside and towards the midline. Ipsilateral, located on or affecting the same side of the body, e.g., right hand and right foot or left hand and left foot. 4. Contralateral, located on or affecting the opposite side of the body, e.g., right hand and left foot or left hand and right foot. Appendix, body cavities and organs, thoracic. Cavity lungs, abdominal, cavity heart diaphragm, pelvic cavity, stomach intestines.